With these things today, at affordable cost, ours is the best corporate hospital that I can tell you. Thanks to the NOMULA group. So this is all about the evolution of the cancer center. I don't want to take much time. But before that, I have some 2-3 wish lists, sir. As a father of the state, let me convey it. So the thing is, in 1969, sir, when Kasu Brahmananda Reddy was the chief minister, this campus was exempted from municipal taxes, sir. I don't know what happened later. We have been paying the taxes, sir. So please consider at least waiver or some concessional treatment to this noble institution which has been rendering a lot of service. Secondly, sir, we have a big campus in university, sir. Very big campus. You know, you are a student of. So there, sir, in case of road widening and all that, most of our space is lost, sir. All our activities have got affected recently in road widening. If that adjacent building, Telugu University building is idle and the land is idle, sir. If it is added, we can add some more activities and do little more work for the society, sir. Thirdly, sir, my dream project is, since you are contemplating a sports university, sir, we have a 10-acre land, this Bhutan land in Ibrahimpatnam, sir. Ibrahimpatnam. We have been conceiving, that's all, we have been dreaming to start a sports school, a residential sports school, only for poor and middle income group, a residential sports school, sir. I would like to have it with public-private participation. If I can do something, I'll be grateful to you, sir. That's all, sir. More than that, I don't want to take your precious time. So thank you very much, sir. At the outset, let me thank the Health Minister Garu, Chief Minister Garu, for gracing the occasion. Thank you.
Now may I request Sridhar Padireddy Garu, MD Renova Hospitals, to share his views with us. Honorable Chief Minister of Telangana, Sri Revanth Reddy Garu, Honorable Health Minister of Telangana, Sri Damodar Adhanarasimharao Garu, Advisor to Telangana Government, Shabir Ali Sir, Hanmantrao Garu, Chairman Durgabha Deshmukh Hospitals, S.V. Rao Garu, Chairman Renova Group of Hospitals, Shastri Garu, and other dignitaries present on the dais, friends from electronic and print media, staff of Durgabha Deshmukh Hospitals and Renova Group of Hospitals. I proudly welcome you to this inauguration of Durgabha Deshmukh Renova Cancer Center. This is the 4th cancer center of Renova Hospitals in Hyderabad. Overall, we have 6 cancer centers in India, and we are adding few more going forward. In 2021, when we started our first cancer center, we had 3 main objectives. The first objective was to create cancer centers closer to the doorstep of common people. Because as all of us know, cancer is a long treatment. The treatment goes for 9 months to 1 year. Most of the patients come back with recurrence, and then the continuation of the treatment goes on. So therefore, it is very difficult even for people living in peripheries of Hyderabad to come for treatment to the main city of Hyderabad. Therefore, what we aimed as a group is to create cancer facilities closer to the doorstep of Hyderabad people to start with, and then expand it to the districts of Telangana and other states of the country. Keeping this in view, we started our first center in Karkana, where there was no cancer center. Recently, we have taken our BB Cancer Center 2 months back in Malakpet, and now we have started in collaboration with DDH, a cancer center in Vidyanagar. All these areas do not have cancer center. So the first aim of ours was to create cancer centers closer to the doorstep of common people. The second main objective was to create boutique cancer centers, which can give affordable cancer care, and also making sure we do ethical treatment. Why boutique centers? Because big centers eat away a lot of overheads, which again have to be put forward to the patients. Therefore, we have been creating cancer centers at 50 to 100 bedded capacity, so that we control the costs, so that we are able to reach to the common people more than bigger corporate hospitals. So that was the second aim. The third aim was to collaborate with like-minded people, especially brands which are doing social service, trust hospitals. If you take BB Cancer Hospital, all of you know that this is the first cancer hospital in Hyderabad. But because it was started 40, 50 years back and the promoters got old, recently the services came down. But that center was catering to the old city population of Hyderabad for ages. So we took over that center, and with help of some efficient doctors, we are trying to revamp that facility. We are doing some reconstruction work there. So that is one center which was doing a lot of good service which we wanted to associate. Now coming to Durgabai Deshmukh hospitals, I am born and brought up in Hyderabad. I was brought up in most of the areas closer to this place, and all of us know since last 40 plus years what is the kind of service DDH has been doing. Therefore, when S.V. Rao sir wanted to start a cancer center here, we came forward. Sir has been very humble to say that, we have agreed to a lot of terms. Who would not agree? Because, they are doing such a great work. I am sure if they had approached for any other corporate hospital, they would have agreed. But it is our luck that, they agreed to collaborate with us, and that's how this center has started. We have started this center in a very short span of 2 years. Basically because there is a team of 10 to 11 oncologists. We all should appreciate them. They all have joined hands with us. I'm very sure with the kind of tariffs sir has asked us to, keep, their earnings will come down to maybe 60%, 70%. But all of them aligned to the social service mindset of Dr. S.V. Rao sir and Renova, and they all agreed to join hands with us. One of them is Dr. Azad sitting on the stage. A lot of other doctors like Dr. Akram and everybody are there. See, it's always easy to dream. Like I said, we had 3 objectives when we started Renova. But to get the dream come true, we need a lot of good collaborations, and we have been very lucky that in form of doctors, in form of BB Cancer Hospital promoters, in form of DDH trustees, we had good collaboration where we are able to take forward our dream of creating affordable cancer centers across the state of Hyderabad. Secondly, sir, I think we have, everyone agree here that we have the most dynamic, young, aggressive, forthcoming, foreseeing Chief Minister ever Telangana had. And also, we all know what an intellectual and knowledgeable person Mr. Damodar Rajanarasimha sir is. So since both of you are here, sir, one small request I would like to make you is that, as I told, cancer is a long treatment and it's very difficult for patients to travel. Therefore, I feel government should create at least one 100-bedded cancer center in every district of Telangana. That should be the main aim. And fortunately, sir, we at Renova Hospitals, I have worked in Basavatarakam Cancer Hospital, Dr. Kiran has worked in Basavatarakam Cancer Hospital. Most of our core group has been working in only oncology for the last 20 years. So if there is anything voluntarily, no monetary requirements are there. Voluntarily, if there is anything that we can do to help the government to start these centers, if the government want to start on their own, we'll help you. If the government want to do some PPP model, we'll help you. But somehow I think Telangana government should focus, as it's the fastest growing state in the country, and Renova is always there to help you, sir. Thank you so much. Thanks for giving this opportunity.
Thank you, sir. Now I request Srimati K. Lakshmi Garu, former President of Parliament Sabha and life trustee of Famous Trust Board, and a very senior life member of Parliament Sabha.
Esteemed guests on the dais, all the representatives from different organizations who have given their hand in carrying our mission, our dream into a reality today. One thing I want to place before our beloved Chief Minister, Health Ministers, and other dignitaries. Andhra Mahila Sabha's main mission has been to cater to the challenges, current challenges of the society. It is with this vision in 52, the governor who started maternity hospital. At that time, gynec issues were important. In 75, when Dr. Deshmukh had some cardiac issue, she immediately said, we are able to resolve our issues. How about common people? Hence, we have to start a cardio center with affordable prices so that middle class, lower middle class, common man will be in a position. Today, her vision and mission has taken form of the current demand of the health needs of the women is cancer. That's what we felt very happy that we could make it a reality in Andhra Sabha by starting it, and my appeal to the hospital group is try to provide a hospital with a reasonable tariff, but with a human care which requires a special type of training among the people working there. So that is more important, more than the tariff. What the cancer patients need is a word of support. Therefore, Andhra Mahila Sabha, paying our respects to our founder, Dr. Shankar Dasi and Dr. C.D. Deshmukh, I appeal to all of you to bless this new venture of Andhra Mahila Sabha. And Andhra Mahila Sabha always works in spite of human representatives because it is based on values. This is what our scriptures have taught us and we follow. Thank you so much.
Thank you, ma'am. Thank you so much for your valuable words.
May I now request the IYR Krishnarao Garu, IAS, Life Trustee for Andhra Mahila Sabha, to please deliver a message for us. Honorable CM Revanth Reddy Garu, Damodar Rajnivasan Garu, and other dignitaries on the dais. Here I am present representing the two institutions that made this a reality. I also have a foot in biological events. I am also a life trustee here. Biological events has donated 6 crores. Today it just so happened all the top management are away from the country. So Mahima Bhatla, the MP and other directors couldn't attend this meeting. But a substantial donation has come from the corporate social responsibility funds of biological events, making this a reality here. Andhra Mahila Sabha, as all of you know, is an institution which started at the time of independence and done a lot of service both here as well as at Chennai. We also have a physiotherapy college which is ready for inauguration at Mahbub Nagar, sir, which is also under the Andhra Mahila Sabha. It is awaiting your opening any day that convenient to you. We'll also get that inaugurated by you, sir. Thank you so much for giving this opportunity. Thank you all.
Thank you, sir. Thank you so very much.
As a token of our gratitude and appreciation, we would like to present a small memento to our donors who have donated huge funds for our noble cause.
So with your permission, we're going to start the presentation.
We request Honorable Chief Minister, sir, to please present the memento. We sincerely thank Dr. Vijay Kumar Datla Foundation, KCSR,
arm of Mrs. Biological Events Limited for the generous donation for constructing our concert block. I request Sri I.R. Krishnara Garu, Director, Biological Events Limited, to please receive the memento on behalf of the foundation.
ఒకసారి గట్టిగా చప్పట్లు. థ్యాంక్ యూ సో మచ్ ఫర్ యువర్ డొనేషన్.
Thank you, sir. Now I request Srimati Nalini Garu, wife of our chairman, Sri S. Rao Garu, to please receive the memento on behalf of their foundation named Ramani Foundation. The foundation has donated rupees 1 crore 100 lakhs for the for our cancer center.
థ్యాంక్ యూ సో మచ్ నళిని గారు.
ఇద్దరికి చెప్పాలి. చైర్మన్ గారు బాగేవారు కదా.
ఒకసారి గట్టిగా చప్పట్లు. థ్యాంక్ యూ సో మచ్ వన్స్ అగైన్.
1 crore. Thank you, sir. I request one of our donors, Srimati Jansi Premanand Garu, daughter of Justice A. Gangadhar Rao Garu, to please receive the memento. Srimati Jansi Premanand has donated rupees 50 lakhs to the cancer center. Ma'am.
ఝాన్సీ ప్రేమానంద్ గారిని సాదరంగా వేదిక మీదకి ఆహ్వానించేస్తున్నాం టు రిసీవ్ ద మొమెంటో. థ్యాంక్ యూ సో మచ్ మ్యామ్. ఒకసారి గట్టిగా చెప్పట్లు.
Our one more valued donor, that is Majid Foundation. I request B. Arun Kumar Garu, representative of Majid Foundation, to please receive the memento. The foundation has donated 25 lakhs to the cancer center.
Let's all clap for Arun Kumar Garu. Thank you so much once again.
We sincerely thank Mrs. Nova Design Build Construction Company for their work in building the cancer block, and I request Sri R. Rajashekar to please receive the memento. Last question, right?
Rajashekar Garu, thank you so much.
I also request Sri R.S. Gaurinath Garu, civil engineer. We appreciate the commitment and professionalism of Sri Gaurinath Garu in the successful completion of the cancer project. I request him to please receive the memento. Now I
Thank you so much everybody. దయచేసి అందరినీ కూర్చోవాల్సిందిగా రిక్వెస్ట్ చేస్తున్నాం. నెక్స్ట్
now I request Sri Damodar Rajvishnu Garu to please address the gathering. Just 2 minutes. Not much. Everybody thank.
eager to listen to the Honorable Chief Minister. I just remember my college days. Almost I spent about 7-8 years in around Usmania University and AMS, which we used to properly call it Andhra Mahila Sabha. It is good evening to all the dignitaries, particularly to my Honorable Chief Minister, the dignitaries on the dais, ladies and gentlemen. This subject is a very interesting and complicated subject as far as health is concerned. And the most alarming is the growth of cancer in Telangana state and overall in the country. Somewhere we have to very seriously concentrate on this. And my Chief Minister has a very clear vision on this NCD, how to deal with NCD. First is the awareness among the common man. For them, it is too late when they come to the hospital. Secondly, establishing the centers in the districts. Slow and steady. The awareness, the screening, preventive measures, and the treatment. As you rightly said, it is a long treatment. The sad part is, one side of the sad part in the hospital segment or the health segment is, somewhere we send the health activists try to drain him out, which is not a good sign at all. I really appreciate the Durgabai District Trust, which has a cherished history, the social activity, educational activity, health activity, elderly care. And I profoundly, from heart of my heart, I congratulate you. And this trust, I remember those days about the 70s and 80s, when in Hyderabad Twin Cities had two illustrious hospitals, one is Gandhi, one is Usmania. At the same time, on par was Durgabai VISHNU Hospital. I remember it. I think 1 or twice my mother came for treatment also. So this government is your government. We got a Honorable Chief Minister who always has a vision. And a man with a vision, very sharp memory, and eager. He is always eager to touch the subject. So we have a plan for future of Telangana with regard to the health sector, whether it is the health cards or whether it is the cancer or with trauma emergency department, palliative care. We have a different vision on this. Next time when I interact with you, I'll let you know what like my Honorable Chief Minister will explain. Thank you very much. Wish you all the best.
Thank you, sir. Thank you so very much. Now it's time for young and dynamic CM Revanth Reddy Garu. We are eagerly waiting to listen to you, please.
I request Honorable Chief Minister to please.
ఆంధ్ర మహిళా సభ ట్రస్ట్ ఆధ్వర్యంలో డాక్టర్ దుర్గాబాయి దేశ్ముఖ్ గారి ఆలోచన విధానాలకు అనుకూలంగా నడుస్తున్న ఈ హాస్పిటల్ ఈరోజు కొత్తగా క్యాన్సర్ ట్రీట్మెంట్ ప్రారంభోత్సవానికి నాతో పాటు సహచార మంత్రివర్గ సభ్యులు దామోదర్ రాజనరసింహ గారిని, తెలంగాణ స్టేట్ గవర్నమెంట్ అడ్వైజర్ మొహమ్మద్ అలీ షబీర్ గారిని, హనుమంతరావు గారిని, మిగతా ముఖ్యులందరిని ఆహ్వానించి ఈ కార్యక్రమాన్ని ఏర్పాటు చేసి ప్రజాసేవలో పేదలకు నిరుపేదలకు వైద్యాన్ని అందించాలి.